Risks and complications. Weight loss surgery, just like any operation, has risks of complication. We will describe some of the complications that can occur after surgery. This list is not complete and does not include rare complications. First, we will review the complications that are common to all the weight loss surgeries, and then we will go over the complications specific to each surgery.
Common to all weight loss surgeries. Like with any surgery, there are risks of bleeding, infection, or injury to organs around the area where we operated. Dehydration can happen due to your reduced ability to drink liquids. All weight loss surgeries involve the potential for nutritional or vitamin deficiencies. It is essential that you take vitamin supplements after weight loss surgery for life. If you have severe vomiting after surgery, it is very important to contact your surgeon immediately so that we can make sure that you don't have any dangerous vitamin deficiencies. Bariatric patients are at an increase for blood clots. These clots can be in the leg, in the lung, or in the abdomen. We can reduce the chance of clots by giving you a blood thinner at the time of surgery, as well as leg compression stockings that reduce the risk of blood clot formation. You can reduce your chance of having a clot by refraining from smoking and taking birth control pills for a month before and after surgery, and by getting out of bed and walking after surgery. The risk of death immediately after bariatric surgery is very low, about 1 in 1,000, lower than even having your gallbladder removed. The two main causes of death after bariatric surgery are pulmonary embolus and heart attack. This is why we have your medical doctor and maybe even a cardiologist evaluate you before surgery to make sure you're in the best shape possible for surgery.
Now we will review some complications that are specific to each type of bariatric procedure. Sleeve gastrectomy. One potential complication in sleeve gastrectomy, which happens around 1 or 2 weeks after surgery, is a staple line leak. This happens in 1 to 2% of cases. Treatment is usually allowing the stomach to rest by feeding the small bowel through a tube, and sometimes endoscopy and/or surgery are needed. Over the long term, some patients who have had the sleeve gastrectomy may develop significant heartburn or acid reflux. Luckily, most of the reflux can be managed with medication and lifestyle changes. Severe reflux not controlled may need surgical conversion to gastric bypass.
Gastric bypass is a very effective operation for weight loss, diabetes, and reflux. However, because the small intestines are rerouted, a very unique set of surgical complications can happen. This includes a leak at the two connections and internal hernia. Both of these complications may need to be treated with surgery. Risk of each is about 1 to 2%. Two non-surgical complications after gastric bypass include marginal ulcers and dumping syndrome. In a marginal ulcer, a small ulcer can form on the small intestine side that is now connected to stomach. Marginal ulcers happen in 6 to 15% of patients. This is treated with acid-reducing medication, avoiding smoking, and NSAID medications. Dumping syndrome can occur if you eat sugary food, eat too quickly or too much, or mix solid food with liquids at the same meal. Symptoms of dumping syndrome include diarrhea, bloating, abdominal pain or cramping, flushing, sweating, and heart palpitations. To keep from getting dumping syndrome after gastric bypass, it is important to avoid sugary foods like cake or candy.
We just told you a lot of complications that can happen from weight loss surgery. So why do we do this surgery? Because the benefits to your health from having the surgery far outweigh the risk of a complication. We look forward to working with you on your weight loss journey. Thank you for listening and for choosing us at Englewood Health.